Next, we have Karen from MediCapt.
Every year, tens of thousands of adults and children around the world are raped in armed conflict, in their communities, in their homes. Most survivors don't report these crimes, but some do come forward, like these women in Congo. But tragically, most of these cases fail because of poor evidence, perpetuating a culture of impunity. Evidence fails because forensic exams are rarely conducted, medical charts are incomplete or illegible, doctors, police, lawyers, and judges, they don't communicate with each other. Hospitals and police stations don't have locked cabinets to store confidential medical records, risking loss, theft, or tampering. And imagine navigating these roads to share evidence. At Physicians for Human Rights, we use science and medicine to document human rights violations. Since 2011, we've been working with medical and legal professionals to improve the way they capture, preserve, and transmit forensic evidence to help support local prosecutions of these crimes. We've been working in Kenya and in Congo, and with our partners, we've developed new skills like forensic photography and new tools like standardized forms to improve documentation. We've also developed MediCapt, a mobile app that pairs a digital medical form with photo capture capacity. MediCapt allows clinicians to capture more compelling medical evidence, to preserve it securely in the cloud, and to safely transmit it to the justice sector. We've co-designed the app with clinicians in Kenya and in Congo, and we're about to go live with patients next month. We've also been working very closely with local authorities to assure that the app is sustainable and fully integrated into existing platforms for mHealth and justice. PHR's cross-sectoral model is transforming prosecutions. Recently, in a landmark judgment in Congo, a court convicted 11 men, including a sitting member of parliament, of crimes against humanity for raping 42 young girls. MediCapt has the potential to multiply these victories. MediCapt is poised to have global impact to document sexual violence cases anywhere, anytime. It can be used with any language, any form, any legal jurisdiction, but we need your help. We would love to tap into Solve Community's ability to think through strategies for scale up and growth. Together, we can make MediCapt a powerful tool to dramatically increase access to justice for survivors. Thank you.
Questions? Jim?
Thank you very much. Very much needed around the world in all contexts. Just a question in terms of the potential for retaliation against the sexual violent victim and the health worker that's engaged. What checks and balances have you built in to protect them?
Thank you for that question. So this is a difficult issue that we're already experiencing, even with our low-tech intervention. What we found is by virtue of creating and cultivating cross-sectoral networks of collaboration, these peers are actually working with each other already to support each other. So for example, when a clinician is already threatened, because that happens, then he has or she has access to a local judge or a police officer to immediately inform, informally and through this network, that this is happening. So in fact, these networks are reinforcing the relationships among all these service providers, all of whom are threatened. Also, the survivor herself or himself also knows who is a trusted first responder they can go to when they receive threats.
Pop?
Yeah, I have a question which actually counter that. I'm interested in knowing who are your biggest supporters and facilitators of your work in countries.
Thank you. Our biggest supporters and facilitators are, in fact, the doctors, nurses, police officers, lawyers, and judges. The judges are so excited about this cross-sectoral collaboration because for them, they've been adjudicating these cases with both arms tied behind their backs. Now they have more data, more evidence to be able to use to make wise and informed decisions. And of course, the survivors feel much more supported because they're coming now to clinicians, police, lawyers, and judges who are more sensitized to take a survivor-centered approach, more dignified, respectful, to not ask judgmental questions, but to take the survivor at his or her own story.
Ngozi?
Yeah, this is a wonderful human rights tool, but can you say a little bit about who is your funding? How are you funded? What does it cost? Because this takes time to document also, and therefore how scalable all over is it?
Yeah, thank you. That's a very important question. So up until now, we've been getting funding from governments, from the United Nations, the UN Trust Fund to Eliminate Violence Against Women, and the World Bank. But this is exactly why we would love to tap into the Solve community's wisdom and expertise to help us think through strategies for financing. Many different models are possible with MediCapt. We are also working closely with local authorities to think about how to integrate that into national budgets. But we really would love to tap into the expertise in this community to help us think creatively about that.
Thank you, Karen.